So, welcome to New Perspectives in Integral Psychology, held by Sri Aurobindo Integral Life Center, Fountain Inn, USA, and Surat in India, in collaboration with our university. We are happy to have with us today Dr. Soumitra Basu and Michael Miovic. It will be a question and answer session about the consciousness-based psychology, with the emphasis on some of its groundbreaking aspects, including the use of psychiatric medications by spiritual seekers, occultism, and the possession model of illness. A few case studies from the book may be mentioned, such as alien abduction, suicide, and the mother's supramental experience of LSD. Let me briefly introduce our eminent speakers. Dr. Soumitra Basu is a psychiatrist by profession, working with consciousness paradigms. He conducts workshops on personal growth and is a founder editor of NAMAH, the Journal of Integral Health. He has authored the book Integral Health and is deeply interested in the vision of integral yoga of Sri Aurobindo and the Mother with regard to mental health. He has developed a module of consciousness-based psychology together with Dr. Michael Miovic. Has authored a book on this, which is now in press and will be published, which looks at psychopathology and counseling from entirely new perspective that arises from the experiential teachings of Sri Aurobindo and the Mother. Dr. Michael Miovic is a general adult psychiatrist with over 20 years of clinical experience in the US, in both outpatient and medical psychiatry setting. He has written a number of articles on Sri Aurobindo's integral yoga psychology and collaborated with colleagues in the US and India to help develop this field. Without further ado, I would request Soumitra Basu and Michael Miovic to address the audience. Please.
Good, thank you. Welcome, everyone. So what I think we decided we're going to do is give a 15, 20-minute overview for those who may not have been present for prior talks, and then we'll open up to question and answers. And as some of you who are listening in the first 10 minutes, we might also make a few comments about healthcare systems and settings, because it's not a topic that we've addressed yet, but it does affect what happens. So basically, to start with the consciousness model of Sri Aurobindo and the Mother, Soumitra and I are coming out with a book on that that's just been accepted for publication. We're in the final stages of editing it. And it's hopefully going to be a fun read and instructive for everyone. There's so much that's relevant to psychology and what Sri Aurobindo and the Mother have done. And so in the book, in addition to talking about the whole consciousness perspective they have, evolution of consciousness, cosmology, planes of consciousness, all of those yogic things, also on the psychological front, the evolution of the psychic being, the relationship between the psychic being and the outer being, the important role of the inner being and subliminal planes of consciousness, cosmic consciousness, opening to typal worlds. And Soumitra's in his last talk just spoke a lot about that, and very interesting questions and answered. I think it's recorded. People can go back and re-listen, right? Yeah, I just did that 2 years ago, two days ago, and that was great. And so I'll let Soumitra now take it from here and talk a little bit more about the model of consciousness-based psychology that you've been using in practice.
So basically, we are using Sri Aurobindo's model of consciousness, and which gives a structure of being that is more complete and more comprehensive there than other personality structures we find in ordinary psychology books. It is more comprehensive. Not only that, it actually includes all the essence of all what has already been contemplated and done, because it is very integral in its outlook. And that, to understand the consciousness model of psychology and healing, it is the first basic thing is to understand the structure of the being. And you see that the structure of the being, which is very comprehensive, has got the outer being which revolves around the ego, and which is always in a state of disharmony, because we have our physical, vital, and mental planes of consciousness which are not in consonance with each other. So I might have a aspiration in the morning to do a lot of studies, that I will read Savitri a lot, but the body can come with a headache. So that's disharmony in the different parts of the being that always goes on, and is modulated by the ego. And the ego itself is biased and skewed because it is made up from the three components of our consciousness. So then we have to go to the inner being, which actually is the plane of consciousness from where Sri Aurobindo's psychology starts. Sri Aurobindo's whole psychology starts from the inner being, which stands behind the outer being. Now, the outer being is what we study as the personality in ordinary psychology. The inner being is not considered to be a subject still in academic disciplines. It is only that our transpersonal psychology and integral psychology movements they are bringing this kind of inner depth into psychology. They are trying to do that. So then you have to understand the inner being with the different parts, which has also different parts. There's the inner mind, there's the inner physical, there's the inner vital, and the inner being extends up to the superconscious, goes down below into not only to the subconscious, but more important, because the subconscious of Sri Aurobindo is what Freud talks about, the unconscious. But below the subconscious is the inconscience, which sinks into the terrestrial inconscience. So when I go down, in my unconscious, at a certain point, I'm no longer an individual. I'm merged with the terrestrial inconscience. So that gives a different perspective altogether. And then again, behind the inner being, there is an inmost being, from where you can experience a state of impersonality. You see, when in psychology we talk of the human being, we talk in terms of personality. But when you talk about the being, the structure of the being in Sri Aurobindo's viewpoint, you have both a dimension of personality and you have a dimension of impersonality. So that makes the structure extremely comprehensive. And now you can locate the different problems at different levels of consciousness with their inner counter, where they actually connect with some movement which is there, some disharmony which is there in their inner depths. And you can go from the outside to the inside, and you can start correcting yourself. And then that is another important thing is what Michael talked about, the psychic being, that is the center of our personality, which is what? It is something which is not the ego, but a beyond ego principle. So based on this module, we are trying to understand the different problems arising at different planes of consciousness and different psychopathological, what you call, problems that arise from those planes, and the psychotherapeutic modalities that we can work out on those planes. Together with this, there are other things outside the structure of the being, which is also which also has to be taken into cognizance if you try to do justice to a total harmony. And for that, there is something in the cosmic consciousness which is beyond me. And because the cosmic consciousness can not only have great positive vibrations, it can have great negative vibrations. So that there are occult effects that can come and that can interfere with us. Then there is the great inconscience from where many things can arise. So all these things makes the matter more interesting, because to have a perfect health, you have to work on different spheres of the being, of consciousness, of personality. So that in the book, so we are not only concerned with working at our different planes of consciousness, we are also there trying to see that how we can work and try to manipulate forces in the cosmic consciousness that can cause occult intrusions into our being, to cause great disharmonies. We are also trying to sort out that. At the same time, we are also trying to develop a model of personal growth through all these things, so that we can grow in our consciousness. It's not only that you get, is we are talking about healing. You have a problem and you heal, but at the same time, the basic thing is, during the whole process, we are trying to grow up in consciousness. We are trying to develop ourselves into higher beings. And to do that, one spectacular thing that we have tried to touch is that, which Sri Aurobindo has said, that to touch upon the different uh, cognitive or supracognitive planes which are there above our cognitive space. You see, we have our mind, but beyond our mind, there are many planes, the higher levels of the mind, spiritual mind range, which was never in our Indian philosophy. It was also not so much probed, because the most interesting thing in India in so long was to jump from the mind to the void, to the great void, to the nirvana, or to the Brahman, or to something which is beyond, beyond, beyond. But here we are trying to actually follow Sri Aurobindo's trajectory of evolution of the cognitive consciousness, and that gives a whole new orientation to the psychology of the future. I think Michael will take up, will
Yeah,
continue from.
that's great. That's a great summary of the book. So I wanted to spend maybe 10 minutes from switching from the theory and the yogic knowledge of Mother Sri Aurobindo's model of consciousness to some considerations about how this unfolds in practice and differences in healthcare systems, countries where a person lives. Because that's something we haven't really discussed yet much in this conversation. And this came to my awareness because in my agenda study group, we've been studying 1965, and that year Mother made a series of comments about doctors that are interesting, both things that she wanted to have contact with the doctor who had all the modern knowledge and opening to consciousness, but also some criticisms of doctors and who sort of give a diagnosis and prognosis that is not helpful or wrong, and it can leave a permanent impression in the consciousness that has a negative effect. So I think that to kind of paint a picture for people who may not be familiar, healthcare is quite different in different countries. So in Soumitra, where he works in India, has a private practice. There's very little to no malpractice. It's just starting in India. There's very little insurance, just starting. There's not much oversight or regulation in terms of regulatory boards and committees and so on. And Soumitra has a lot of creativity and freedom to sort of practice in the way he wants to, and also then the patients who feel drawn to that can come to him. And he also sees a very high volume of patients, 80 patients a day or more, because there are not many psychiatrists in India. Plus, he's a very talented psychiatrist, and he writes very, very little notes to no notes on a busy day. Now, contrast that to the opposite end of the spectrum, where I work in the United States, which is a completely different healthcare system. Private practice has mostly been absorbed into kind of big systems of corporate or government medical practices where you're part of a big group, and then you have to follow all the oversights and regulations that are put upon you. So I'll see 8 to 10 patients in a day. I work in the VA healthcare system, which is probably the most highly regulated system in the United States because it's government funded and overseen by Congress. And there's a big concern about veteran suicide. So I spend 50% of my day on documentation in a computer. Huge amount of documentation that I have to do. Most of it I consider worthless, but I don't have any freedom to say I don't think this is useful. There's, as people know, the United States has a lot of malpractice lawsuits, big settlements. There's medical insurance. You can't get healthcare without medical insurance. It's too expensive if you don't have insurance. And then those insurance companies have all sorts of conditions and demands that they place upon people in terms of documentation and practice. So it's a very different kind of system. The downside is there's a loss of freedom and creativity of the individual, but what they're trying to gain is quality control and standardization. And so when you look at healthcare from the extreme of kind of freedom to this, there's a series of trade-offs where at every step of that continuum from total freedom and creativity to kind of total quality control, something is gained and something is lost as you move across that spectrum. And there is no way to get the best of all. That's important to understand. You can only go through a series of trade-offs, and at every step, something is gained and something is lost. So that's one real consideration. Where you are in different, Europe is again different from the United States, and South America is different. So different countries have different healthcare systems and the way things unfold. That affects also the patient experience as they move through that healthcare system. Another big thing to think about in medical practice is that medical culture has really evolved from the time of the agenda. So if you look at Mother's comments in the 1960s. So in the 1960s, they were just beginning to develop somewhat good evidence for a few diseases, but it was not robust. The amount of statistical high quality evidence that we have today from randomized controlled trials is vastly bigger, enormously bigger than the 1960s. So that's one thing, that the statistics and empirical data that's available is more robust. There's been a huge change in imaging technologies. For a lot of people, things don't become real until you can take a picture of it. And when you can picture it, it's like, oh my God, there it is. It's real. And we have pictures of everything. We can send cameras into every vessel, into every organ. We can send cameras, we can image cells now, and brains, and neural networks. So what imaging technology has done to medicine is extraordinary, and it has made real the entire world that the mother was, she alone was aware of in the 1960s, was being able to see the reality of cellular life in the way that she did. So that's been a huge change in medicine. And then there's also been a big change in medical culture. So, traditionally, doctors were viewed as these kind of godlike figures who couldn't be questioned and who somehow magically knew everything. And patient would come and doctor would give them a diagnosis and tell them a prognosis, and this is what you have to do, and they'd go away. And there'd be no question about that. And so that was the paternalistic model of medicine. That really started to change. It's all started in the 70s, but it's been more and more and more, and there's been a huge change in the last 20, 30 years. So we now have what's called the shared decision-making model, which is a democratic model of medicine. And in that model, the doctor views one of their core responsibilities as doing the workup, making the diagnosis, and then discussing treatment options with the patient in accordance with their values and wishes. So the doctor in this model sees, that they should present, okay, for this condition, diabetes or heart disease or major depression or multiple sclerosis, whatever it is, here are the first 2 or 3 standard treatments for someone in your condition. Here's the risks and benefits of each approach. You could also do nothing. You could also do lifestyle. Here's the data. You decide. And so they view themselves as kind of experts on data. And the patient then asks questions and decides what they want to do. And the patient is understood ultimately as the author of their own decision. And so actually now doctors really, most doctors don't have much trouble with, patients doing whatever they want to do, including integrative and complementary treatments. Where the biggest conflicts actually happen are in ICUs, where certain patients and families want to continue very aggressive medical interventions that the doctors know statistically are futile, and they feel like it's a punishment to the patient. It is a harm. And that's where you see the highest level of moral conflict today. And those are the biggest conflicts that happen, at least here in the United States. And they have ethics committees and all kinds of procedures that they go through to try to sort out these conflicts. but it's the other way. It's not the doctor trying to force the patient to take some treatment. It's the other way. The patient is trying to force the medical system to give them a very invasive treatment that the medical system feels uncomfortable with. So then the fourth, another big change in culture, which some of you heard Soumitra talking about, is the internet and Googling. So many people now are finding so much information about diagnoses and treatments and medications and so on the web. Some of it good information, some of it not so good information. There are chat rooms that are full of people sort of airing their perspective, likes and dislikes. Come into the consulting room with people already having had impressions and what they want done or not done. So, and then the last thing I just wanted to point out is the complexity of medical communication. It's really not straightforward. So the doctor may say one thing, but what the patient hears and remembers may be a different thing. And so I've done this in my practice and also when I'm teaching residents, after talking with a patient for 20, 30 minutes, I may say, okay, well, we've talked about a lot of things. And so I'm just, could you repeat back to me, like, what are the three main points that you take away from our conversation today? What are you going to remember? And you would be stunned that up to 50% of the time, one of the things they tell me is something I did not say at all. It was something they were thinking or interpreting or listening to me and developing on their own. And that's just a small example of that medical communication is not a straightforward thing. And so you also have to think about that as you're sort of thinking about these doctor-patient interactions and what is happening in healthcare. I can tell you in the United States where you have these complex systems with clinics with all kinds of specialties and labs that people are going to and being sent here left and right. And I mean, oh my gosh, the communication, the patient goes, meets all these different people, and at the end of the day, they get home, they don't even know what was told to them because they got so many different messages, some of them conflicting with each other. And then they get printouts, like 30 pages of papers at the end of the day. You get home and it's like they're tired, they're exhausted, and who knows what they took away from the whole thing. And then there's 30 pages that they really don't have the energy to read. So medical communication is a rising issue that's being studied. So I'll stop there. That's more on the practical side. So why don't we open up the floor to questions about consciousness-based psychology cases?
There have been two questions already.
Mm-hmm.
So one is on depression and one is on dreams.
Mm-hmm. Would you like me to read, or you just follow up with the questions?
You can read. You can read the question.
Yeah, because others may hear. I'm not sure that everybody sees the questions. Please refer to depression if you deem it fit to be discussed on today's program. That is the first one. If you would like to address this. And there are more about dreams, and there is a question about Stanislav Graph and his work, which is very interesting in a way.
Yeah.
So, and there are more coming up.
Yeah.
So let us start with what you like to address, rather the dreams, or the depression, or Stanislav Graph.
Start with dreams, Soumitra. Soumitra's written a beautiful chapter on dreams in the book. There's so much richness on this topic from Mother and Sri Aurobindo.
So both in dreams and also the first question was on depression. And about depression, we have tried to cover because depression is a theme that has been explored in details also through many questions that were asked to the Mother and Sri Aurobindo, and they had given a lot of illuminating answers also. So depression we consider in our scheme of things to be something that is arising in the vital plane of consciousness, and because the vital has got conflicting emotions. You see, the vital is our emotional repertoire, and it is consisting of conflicting emotions. So that means that if you have depression, then the opposite of depression, which you see in bipolar disorder, it is not unexpected if you know the structure of the vital. And also because of that, because the vital nature of the vital is that there are always conflicting emotions there holding that consciousness there. So you will not be surprised that in children, depression often expresses itself through aggression. So all these different modalities are there, because if you understand the structure of the vital properly, then it will give you a very good understanding of depression. In our system, so we would just I would just very shortly say that uh, we have to give medicines to our patients. Even in our model, you see, I also give medicines. It's not that I don't give antidepressants, but choice of medicines and choice of my what you call approach depends upon the plane of consciousness in which the person is operating. Or in other words, to me, to us who are practicing this consciousness based psychology, we would prefer two types of classification. One is the official classification of diseases, that is WHO or DSM sponsored, which you need for the statistics. But then we have our own classification according to our planes of consciousness, our own internal classification that we also do, and that is more important to us. So when a person with a depression comes to me, and then I see that what plane of consciousness that person is operating. Of course, if he has got a consciousness which is very rustic, and then the loading would be more towards trying to intervene at the physical level. But if a person has a lot of finesse, is creative, is an artist, then of course I would not give medicines in a way which would stifle his creativity. I'd be very conscious and cautious about it. At the same time, and I will try how to use his creative potentials to treat his depression or to utilize it in his therapy. On the other hand, a person who is living more in the inner being, or who has got a more soul contact, who has got a psychic experience, you don't have to do too much. You have to just turn the person inwards a bit, and then the rest follows. So all, see, it is the same thing, but you are doing it from a different perspective, and you are understanding a person at different levels of the consciousness. So that is very important. Other things, even with dreams, I will tell you, very interesting with depression and dreams. Often I used to see in my early days people of depression taking the very best treatment, and they were not. This is my Indian experience. I would not know the Western one. I would see that they were never getting treated. They were never getting better, and then I was wondering that what happened. Why don't they get better? It's not following the formula. And then I started asking them about their dreams, and I was surprised to find that many of them were dreaming still of the people who had died, their parents or very people very close to them, but who had passed away long back. Which you see that in, if you see from our modern psychological probings of psychoanalysis and all, if you see that, then if you dream like that after a long time, after the person has passed away, then it increases your unconscious death wishes. But in India, we have the system of tantra, which I explained to the parent. I explained to these people that if you dream like that, if you are too much attached to that person, if you don't leave that person, you cling to him, then his soul will find it difficult, or his vital being will find it difficult to progress. And therefore, it is the soul of that person who has passed away will suffer, and you will also suffer, because negative forces from that world, from that occult world, will come and will never allow you to come out of your depression. It can cause also more disharmony in the family. So when I found that so many people were actually dreaming in depressed patients of people who had passed away, and they were clinging to them, unable to hold them, then I included this in my therapy. Every patient of depression, I ask them about this, and then I tell them that how to get hold, how to get detached from the person who has passed away. And I take the example of tantra, because in Indian culture that will be very that is acceptable to people. This is a very simple thing. I tell them to pray before going to bed, that let the soul of the person who has passed away, let the Almighty put it in the proper place where it should be kept. And this very simple thing that works, at the change, the dream changes and the person responds. So all so many things come together in our integral model. You have to be sensitive to all other things. About the dream which Michael told about this chapter, we have tried to analyze dreams arising from the different planes of consciousness, not only from the subconscious, not only dreams that come from the subconscious, but also very specially dreams that come from the inner being, from the subliminal consciousness, which is very important. And then if you can understand those dreams, then you can understand that is a meaning of the dream which will be relevant in your life, which can be relevant in therapy. Often also there are occult intrusions in dreams. For example, Michael was talking about the ICU, and I had a patient that day who had come in my city, Calcutta. So one non-resident Indian, a foreigner Indian, wanted to build a big hospital, neurosciences, and no space was available. The only space that was available was a corner of a big cremation ground, a Christian burial ground, which has been there for hundreds, more than 200 years, I think. And that corner was given to them to build that big hospital. And now one patient who didn't know that there was a graveyard below, she came to me because she had a stroke and she was admitted into that ICU. And then when she came to me, she told me she was recovered. And then she came to me and she told, no, doctor, I have not come to you for any other thing. While I was in the ICU, I was dreaming every day, dreaming of rows of graves. Actually, there were rows of graves behind the hospital, but she didn't know. Well, she was in an ICU, which is a closed space. She didn't know there was a graveyard beyond that. And I saw that there were rows of graves, and there were these beings who were standing there. These beings, there's subtle beings, and who were telling me that people who don't comply with us, we just straight bring them from the ICU and we just push them into the grave. And that is the dream which you are seeing every day. And you see that it was exactly that, because the ICU, what happens in the ICU, so many people die, so the space is very heavy, and the occult presence of vital beings is very strong in the ICU. ICU is not a very good place to die. We die nowadays a very impersonal death in the ICU, with so many tubes and so many things running over. So then I made it a point. That's why that when elderly people get ill, I try to motivate the people that let him pass away in the comfort of the home with his relatives. Don't push him unnecessarily into an ICU to force all these things into the person, so that the death is so so raw. There are no grace left in that passing away. So all these things. So we have got a lot of these dreams. We have analyzed dreams which have occult influences, which have subliminal meanings, and dreams that come also from very high spheres of consciousness. There are dreams that come from superconscious planes, and sometimes those dreams can also have an effect throughout life. For example, I saw a neurotic person who has been suffered from a carpenter. He has been suffering from depression and anxiety for about 30 years. And it all started when, as a child, he dreamt that he was lifted in the sky by a god. And when they went very high above, the god released his hand and he fell down on the earth. So that insecurity in the dream has persisted throughout his life and has caused his anxiety and depression for 30, 40 years. So you see that all sorts of strange things happen. So there are, from the consciousness perspective, there are many other ways in which you can analyze dreams. So that's what we have tried to present there.
You also mentioned, you quoted, Mother had a very nice discussion of how this question of dream symbolism. And she talked about her own dream symbolism had changed 4 or 5 times in her life. And she said actually that each person's dream symbolism is unique to that person, that you can't generalize across people.
You can't generalize.
Yeah.
The common example is the dream of snakes. Snakes have different meanings at different levels of consciousness. So if at one level it's a very vital symbolizing libidinal drives and all, but at some other level it can also symbolize the kundalini. It can, at some other level, it can symbolize some other thing. So the same symbol at different levels of consciousness has different meanings. So that's why to understand the dream, it is not just to relate. You have to relate the dream to the consciousness of the person and the state of consciousness in which he has dreamt. So it's going to be a what you call complicated affair, not a very simple thing that you just take a meaning and you just ascribe that
Right.
this is what.
Yeah. It's a complex thing. So maybe we should talk a little bit about this whole question of Stanislav Graph and psychedelics. Psychedelics are making a comeback. So, I mean, there's been a push to try to research psychedelics for decades on the fringe. It's really gained momentum. So, actually, now I work for the VA hospital in the United States, which is government funded healthcare for veterans. And the VA hospital is now very large international study of using psilocybin to treat PTSD and substance use. And so this is coming out of work on multiple fronts. So there's been some research on using psilocybin with patients who have terminal illness and have anxiety about death and dying. And that protocol would use psilocybin with two therapists with the patient to kind of structure the experience in a positive way for many hours as it's unfolding. There's a thing called, I think it's the psychedelic MAP, I forget what it means, but it's a psychedelic research network in the United States that's been there for a long time. Of course, in the United States, also, psychedelics have been used by Native Americans as part of traditional healing for hundreds of years. And people can even have always been able to go get that through the Native American church. That's one branch that does that. And I actually met a woman on a plane once who had been through an amazing healing through the Native American church and use of psychedelics. She had previously gone on a spiritual quest to India and Nepal, spent a lot of time in some ashrams and Buddhist places, and had a lot of amazing growth in consciousness. But she had chronic pain and depression that didn't respond. And then she did a couple of years of work with the Native American church and would follow it around. It's a traveling thing. And she was cured. And I met her on an airplane as she was coming back from Alaska, where she had hiked, 30 peaks over the summer. So those possibilities are certainly there. One researcher in that area is Stanislav Graph, who, going way back to the 60s, had done work. And there are other people in the transpersonal community who've done work with psychedelics. And then Soumitra, do you want to? Mother had an absolutely stunning discussion of psychedelics in the agenda, and there was actually two conversations. So the first conversation is, I think it's 1966, maybe 66. So there was an Italian disciple who was visiting the ashram and had been using LSD. And wrote to Mother about his experiences and how he had a bad trip and was seeing frightening faces and images and so on. And Mother at the same time had been reading about psychedelics in Life magazine, because it was already, the hippie thing was starting and it was a global phenomenon. And so she discusses with Satprem in that conversation. She doesn't use the word Rorschach test, but she's basically describing a Rorschach test. She says how the LSD reveals the consciousness that the person has inside in their subconscious or in their lower vital. And so that depending on the quality of the consciousness that someone has, that will be manifested in the experience when they take LSD. And so right there was a very open-minded and insightful discussion, and also completely non-judgmental, because she didn't tell the Italian man to stop taking it, and she didn't tell him to leave the ashram. She just, gave him, she worked with him in her standard way of divine love. And then a year later, she returned to this in April 1967, a few months before the Summer of Love unfolded in San Francisco. She decided that she wanted to experience the consciousness of LSD that all these young people were talking about. But she did it without taking the substance at all. So she identified her consciousness with the molecule of LSD. And she then describes an absolutely convincing LSD trip. I mean, the description of it is, with all the physical details and unbelievable. It's absolutely clear that she had a physical experience of LSD without having taken the substance. And she talks about how that it created a disharmony in the being by sort of overemphasizing a certain aspect of the realms of senses in exclusion to others. And then Soumitra, you've sort of studied a ecology of this. Maybe you could comment on that, of how LSD is now thought to work, or other psychedelics. Are you there?
I'm having problems here with the connection. Now, please.
Okay. Yeah. So
the mother gave what mother described about LSD was exactly what happens um, um, what she has told, that when LSD is taken was exactly the same what people now who do research on LSD, they say that you have some experience at the cost of suppressing some other area of the brain, and you release some other area where you have some other activities. And so that was a very brilliant way. We have analyzed it fully, that what previously we thought that how psychedelics acted, how they inhibited parts of the brain, and now that mother's current description actually fits in with what researchers nowadays have found out, that what she told was right, that some areas are released at the cost of some areas down the line they were suppressed. So and that was a very spectacular way. We have analyzed it fully, that we have given the details in our book of all the recent researches, and how it corroborates with what mother said about LSD. But more, you see that it has to be seen in a broader context. She was more interested actually as a part of the counterculture movement, and which she said that the counterculture movement actually started because the supramental touched the earth and unleashed a lot of new forces. So people are wanting new things. You have to understand that the counterculture was trying to understand things in a very new way. Pavitrada has analyzed it very nicely in one of his essays, where he showed that even during the Renaissance, inspiration was taken from the past. But in the 1960s, for the first time, the youth all over the world had decided to do away with the past, to be entirely to do something entirely new, because they were fed up with three things: fed up with religion, which had become lip service; fed up with politics, which had become hypocrisy; and fed up with science, because by that time it was understood that science can give utility but not the truth. So as a result of that, this counterculture movement happened, and this is that whole play which was very interesting to the mother. For example, the music. And she told about when she was hearing that new age music, she was saying, she explained that they had kicked away the mind with all its complexities had been kicked away. So that was something was churning out. Afterwards, that movement didn't last long. That it is understandable, because when you have kicked out the past, but something new has not come to take its place, a new value system has not come to take its place, then a vacuum, and then afterwards something else can happen. Remember, the counterculture movement was a movement when the value of internationalism came in the world. All over the world, the youth were hearing the same music. The people were hearing the Beatles songs. It was John Lennon was talking about the Imagine series. Martin Luther King was talking about what do you call, the rights of the blacks without denigrating the whites. You see, there was a value of internationalism, and when that movement went away, it is very sad that the world witnessed a different thing: secessionism. We had ethnic conflicts in Bosnia, Serbia, all the other things followed. So that was a very great period. So though the outcome was different, but the inception was very great. And that's why that was the mother's interest in following that whole phenomenon, that what was unraveling, and something new that was going to happen, and there was news, something new that was going to come. So in that context, you have to see the LSD experience not as an isolated way that it was just trying to understand the psychedelics, but as a part of a whole movement that was emerging in the global youth set. It is now only the global mindset is now changing in a different way. At that time, it started changing with that when there was the shift from modernism to postmodernism. And now the change is occurring in a more solid way. What you see, the global youth culture now is changing from a linear thinking to a non-linear thinking. So all those things were needed in the background to come to this stage. And now when we mind is shifting from the way of the thinking pattern is shifting from the linear to non-linear way of thinking, the time has now come, right, to understand what Sri Aurobindo gave to the world, because what Sri Aurobindo gave to the world has taken 100 years to sink into the consciousness of the earth, so that now people can understand it. Before, people were not ready to understand this whole thing unless the something changed in the thinking pattern in a global way. Of course, there were great exceptional individuals who are always understanding Sri Aurobindo, but at a very global level, that now the time is ripe for such things like what we are wanting to present, a new type of psychology based on consciousness and all that. You have to understand the time, because the mind culture, but the mind has changed. But before this mind changed in this way, you needed to have that counterculture movement of the 60s. So all they were stepping stones towards what is happening today. Things are changing, and we hope that now we will have an audience who would appreciate Sri Aurobindo's viewpoint and understand things from a new perspective.
Yeah.
So you see the whole panorama of change in the consciousness that is occurring.
It's I get to see a very special manifestation of that working in the VA hospital with the veterans. So the bulk of our veterans now are Vietnam era veterans, who went to Vietnam. Most World War II veterans have passed on, and most Korean vets have passed on. And largest numbers from Vietnam, because we still had to draft smaller numbers from the more recent wars. But it's interesting because so the VA has embraced whole health model as the overarching framework for all of healthcare, not just one part of it. And it's a big national initiative. And they have a very robust program in teaching mindfulness, meditation, yoga, Tai Chi, stress reduction. They're also, they have some chiropractic, acupuncture, and they're doing a very good job of sort of developing this as the culture of medicine that they want the system to move towards in 20 years. And so there's this amazing phenomenon of, I'm working with Vietnam vets, and they're all now learning meditation. They're taking medical marijuana, and they're hoping to get involved in psilocybin research studies. So they've become hippies, I mean, it's like, it's just 50 years later, and what was counterculture is now, evidence-based treatment in the VA healthcare system. But it should point out that is part of what changed is the amount of evidence that accumulated. So there's been a huge amount of research into mindfulness, meditation, stress reduction, how it's beneficial for health, even some of the mechanisms through which it's beneficial in the brain and the body and so on. And it's because of the amount of research that's been done that insurance companies in the United States now pay for it, and that the VA healthcare system is promoting it. And so I sort of joke that what's happened is that in the last 100 years, science has proven that the Buddha beat Freud. So nobody does psychoanalysis anymore in contemporary healthcare systems. There are a few small psychoanalysts in private practice, but they're not doing the methods that Freud did. But in healthcare systems, which is 99% of the care that goes on, people are really practicing clinical Buddhism is what they're doing, combined with pharmacology and modern science. And so then that raises the question of, well, so that now that the culture, the medical culture, has come to accept that the Buddha was right, they've come to 2,500 years ago. They're at 500 BC, you know. And so now the question is, well, what happened in Indian philosophy and spirituality and yoga after the Buddha? What else developed? And so Sri Aurobindo is the answer he's the summary of everything that happened in Indian spirituality, yoga, since the time of the Buddha. And so I think that what we're seeing now, as you say, Soumitra, it's a platform. The culture is really getting ready to receive Sri Aurobindo in a very big way, in a widespread way. And so that's coming over the next few decades.
That's a very nice comment. Thank you for this overview. And I think this is something which is really reaching this question about Stanislav Graph, and when he started his analysis of embryonic life and how people remembered how they were conceived and how they started to grow, these 4 stages, oceanic stage and so on. And then later he identified them with the whole development of 10 avatars and the embryonic life, how embryon is developing and covering all the stages of evolution step by step, you know, from the fish level where the embryo is like fish, and then like an animal, then finally like a human being. So within 9 months, the person undergoes the memory of the whole evolution on Earth from the beginning till the end. Within 9 months, we cover all the psychological stages of vibrations, consciousness of all the species developed on Earth. This is something to think of, you know, and of course, to carry that memory, to carry that experience, is something we have to tap into. It was the beginning, of course, of this Stanislav Graph, and it was a wonderful. It was like eye-opening. You know, science suddenly tapped into something which is called mythology or religion. People were drawing these stages of Mahakali. They never saw Mahakali. They never knew about her existing, but they were making these pictures. And this release finally after 9 months, being mukti, being freed into a new. So these are kind of again making a link to something deeper. And what you built, I wanted to comment on this, what you built on consciousness-built psychology, base psychology, on Sri Aurobindo's vision is also going deeper into the Vedic knowledge, into the knowledge of Hinduism, which is even beyond Buddhism, because Buddhism speaks only the psychological language, which is closer to our mind, but there is a deeper layer beyond Buddhism, yes, which is tapping into the more inconscient, subconscious level and superconscient levels, which Aurobindo covers in his approach, in his integral yoga psychology. So this is a new field for us. It's very interesting. It opens up the gates to the studies of these texts from the psychological point of view. And you know, in the Indian Psychology Institute, we studied Vedas with Matthias for many years because we wanted to tap into that psychological content, to view it differently, not through religious eyes, but through the.
Let me make a comment on the kind of as things get more psychological. There's an issue to be aware of. A potential trap, which is Western psychotherapy. And there's many different schools. But you know, there's a trend in Western psychotherapy, particularly if you talk to the common person. They have this idea that therapy is you go back to the past, and if you resolve some issue in the past, then everything now will be fine. And so then they've argued about, well, what is that issue in the past? You know, was it the Oedipus complex? Was it some lack of nurturing? Was it a lack of empathy? Was it a trauma? You know, and you can even take it back to, was it a past life that you're carrying a memory from a past life? But a lot of people in the West approach therapy with this idea that you're going to look at the past and you're going to find the cause, quote, of your problem now. You will resolve that cause and now you'll be fine. And Sri Aurobindo's model really is not like that. It's focused on the future more than anything else. And that for Sri Aurobindo and the mother, the solution is looking forward and growing to the future that will, heal the past and set the present straight. So, Soumitra, you might want to comment a little bit this on kind of past life regression therapy and how you've approached that in practice.
What we feel very much from Sri Aurobindo's viewpoint is that, as Sri Aurobindo has clearly explained, that the subconscious of every person is formed for this life only. It dissolves in this life. It is not carried for. It is not carried forward like that with that individuality. It is not carried forward. And what is carried forward is the memories in the psychic being. You see that all memories are not encrypted in the psychic being. And usually the memories which are most intense or which have a divine element, only they are there in the psychic being, and they remain as memory transcripts in the cosmic consciousness. They remain there. So the other things, the outer personality is constructed at every birth in consonance with the culture and milieu and the temperament of that age. According to the time spirit, the zeitgeist, it is constructed. So the outer personality, it dissolves. It is not carried from life to life. What is carried is the memories in the psychic being, they are carried. So from our perspective, and as Michael said, that for Sri Aurobindo, the future, there is one of his favorite phrases of Sri Aurobindo was the unborn future. So that unborn future is that which holds the potentiality, and we have to grow there. Then the things which are already going to be excluded, which are already in the process of exclusion, if we identify with those things, then it is actually a waste of energy. We have to carry forwards. Now then you can tell that many people come and tell that they have memories of their past life memories, or they have very vivid memories that they were this, they were that in past life. And some of them actually on cross-checking, we find that it might have some relevance. You see, sometimes there is some relevance. For example, one autistic child was brought to me, a 3-year-old autistic child who couldn't make, who had no language but made sounds like this. Very strange sounds, a Bengali child, but the parents brought what you call alphabets in cardboards, what you call in small alphabets. You see, A, B, C, D, E, F, all these things were there in these small cardboard settings, and he was placed with that whole array of alphabets, and he was just arranged the words in such a way that the word MURD, murder, came out. So it seems that he had been murdered in the past life. So how do you explain that? If you see that the psychic being carries memories and all these things are not carried. Now there is an explanation. This is actually a vital being carrying a memory. So this is not exactly that psychic being. This is actually, even from Sri Aurobindo's point of view, it is a vital memory, or it is a vital being that is carrying a memory, might be of that. It might be related to that child, or it might not be related to that child. It might be using the child as a medium to express itself. But if you are dealing with a vital being, it is not going to improve your health. It is not going to improve your health. Dealing with vital memories of the vital being, which can persist in the atmosphere for some time. You see, most after death, after a person has died, many people see the departed ones. They come and they feel for a few days. It doesn't remain for a long time. So often these vital entities don't remain for a long time. But identifying with them or catering to them has no connection with health. So if you are concerned with health issues, it is much better to concern yourself with the future, to concentrate around the or to concentrate around the psychic being. And if you are wanting to build up a better health, which will be relevant for the future, in future lives, it is best is to increase your repertoire of psychic memories. You see, the psychic contains all those memories which are the most beautiful and the most intense memories of life. So you can increase that, which will remain in the, which as memory transcripts, they will remain in the cosmic consciousness, and afterwards they can influence not once, not one, but many people at many times. You don't know. If the Beethoven's music is recorded somewhere, and then it can influence many people who are receptive to Beethoven's music. It's not like that. Rebirth is a very complex issue. We have tried to touch a little bit there in our book, but what we have tried to emphasize that our outlook is for the future. So, and then of course in Savitri, as Sri Aurobindo said, that when you identify with the Jivatma, then at a stroke you are cut off from the past karmas. All the baggage of the past karma you don't have to carry forward if you identify yourself with the Jivatma, so that you can move forward. So always moving forward is our aim. Past life therapies in this perspective doesn't hold that much of value. It looks a very spectacular, because people, when you talk about past lives, they can come up with very fanciful stories, and then psychologically you can identify with them, and for some time you can feel that you are there in that air, but then it is a temporary thing. It doesn't last for a long time.
Yeah. Let's also talk a little bit about the whole possession model of illness. This is a very fascinating topic, and we have about half an hour left. So I'll start with, the healthcare system I work in. I can't walk around talking about possession and saying that someone is possessed, because I'm writing notes that are read by hundreds of people. And even if there's one or two people who are sympathetic to me, 99% are not. So then how do you operate in a system like that, which is a very different system where Soumitra works, where there's much more openness to these perspectives, and it's more individual between the patient and him, what they find helpful. So I learned one big lesson in residency. I had a gentleman with, I had just started in a day hospital, and I was called with my senior resident to go interview a patient with schizophrenia who had been in intense lockdown for 2 years because he had tried to murder a psychiatrist. He had attacked the person and almost killed them. And he had very severe homicidal fantasies and hallucinations. So he was in intensive lockdown for 2 years, and then he was better. They had put him on a medicine called clozapine, which is a powerful antipsychotic. And then he had been out for 3 months and was in an outpatient setting. So we went to interview him, and I walked into the room, and immediately, literally, the hair on the back of my neck stood up. And I looked at him and saw nothing but darkness. And I knew that I was in the presence of a very hostile, vital being. It was frightening. I really just wanted to leave the room. I did not want to be there. And so naturally, I just sat and invoked the mother for protection while the senior resident did the interview. We weren't there long, and then we left. I was not assigned to take care of this person, and then I rotated on to a different service. And then about a year later, I was taking the bus to work, and I saw this same patient who was sitting. I sat down next to him on the bus, and he looked like a completely different person. He was so sweet and so gentle. And, you could tell that he was a little confused and had some cognitive processing problems, but he just had such a beautiful aura, and he was like considerate for the people around him, is very gentle. And I looked at his aura, and you could still, like, maybe deep inside him, seeing just a little bit of that darkness left, but just a little bit. Most of it was gone, And so I went and asked my friends what had happened, and they had been taking care of him, the outpatient, for a year. And he had had just standard supportive therapy and continuing of medications and groups, and nothing special, just usual care. And he looked like such a different person, and his aura had completely changed. And that's where I came to understand that standard practice also has occult influences. Because all the goodwill of the people around him had a positive influence on him. Also, the goodwill of the system, that the society that dedicated money to take care of him. So there was a social pact, there was an ethical pact, there was a whole structure of understanding of the medical ethics, that we're not going to punish someone for a mental illness. And because he was violent in the, in the fit of psychosis, doesn't mean that we're going to hold this against him for the rest of his life. And so much goodwill and kindness and compassion went into trying to help this person. And it had a remarkable effect. Nobody there had any yogic knowledge. Nobody had any shamanistic knowledge. No one had any occult perceptions. And yet I could see what a powerful spiritual intervention it was for that person. So that's a reminder that standard of care, what we call standard of care, is also has occult influences. In addition to the more complex cases that Soumitra will talk about, where you can work in a more openly occult way.
The consciousness of goodwill has got an incipient occult vibration. So always the consciousness of goodwill that carries an incipient occult vibration, that always carries. So even what the doctors with enormous amount of goodwill and sincerity they do, they are also imparting and what you call an occult dimension to their in their treatment. Unknowingly they are doing that.
Yeah.
I think that Vladimir, there are questions there. I think that some of them.
There are questions. And just to finish this topic, one smaller remark, because you speak about consciousness-based psychology on Sri Aurobindo's ground. And I think both could be viewed as influences of the impersonal nature. In a way, the personality is there, some kind of jammed between these two great, influences of the upper hemisphere or deeper, loving, light hemisphere, and lower, darker, and all kind of mixed forces. And in between this personality, which perceives itself as such, identifies itself with those influences and those surroundings within, and accommodates those forces. Basically, it's a beautiful vision of viewing that everything is done by nature, as Shri Krishna says in the Gita. So everything good and bad, and it depends what you aspire for to be. Yes, where you are heading at, and so what you identify your consciousness with. Yeah, whom are you with, so to say, with what forces, so that they manifest through you, within you, in your action. So it's a kind of a new developmental paradigm of psychology, which is very beautiful and very promising in a way. There are questions here more. Somebody is asking that they're surprised that you have 80 patients a day. It's too many, as you see it most probably yourself. So as most psychologists' problems are patients who have no one to listen to and understand their agony, it's quite difficult if you don't have enough time to listen to them. So how do you do that? Can you explain?
Yes, first of all, two to three things. First, of course, I give time to people, separate time to people who need more time. Then we operate with a team so that we have our psychologists and psychiatric social workers who also make up for those people who need a little bit of more time. And but the main thing is that to do justice, I have to be intuitive. So I have developed myself, or I have to develop myself to the point where my intuition works when I am working with a greater load of patients, and then I have to work fast, because in India they come from very distant places, and if I am late, then they will not be able to go back home. Say 200, 300 kilometers, they will not be able to travel home, or they might miss the boat, or they will be stranded in the riverfront. All these things, practical things happen. So you have to be very intuitive, and but it is difficult to always to keep the intuition. So you have to be very concentrated. Fortunately, I don't know how others do, but I am fortunate to have mother and Sri Aurobindo, so always I invoke them, and I try to be at my intuitive best, so that when I am dealing with a large number of people, where I have to work fast. But in practice also, I also work with a team, and we have sufficient people, so that they are also there to branch out and to especially work with people who need a little bit of more time. So that's how we have to manage this. India is a country with a lot of people, and then we have to cater to our needs. And another thing which is very what you call useful in India is that in India people it is not, people are not that much rational. People are also by and large more intuitive, that many things if I don't say, the patient will understand, even the way non-verbal communication acts. But if you work with in a more rational society, then you have to spell out everything, otherwise you will not be able to make people understand what you want to say. But in India, that still it is there, that element is there, that that non-verbally what we want to communicate can be received by people. That culture is still there. So we are fortunate in that way.
By the
Let me
way,
make a few comments on that. So the
Yes,
idea
yes.
that you know, that more time in therapy will lead to better outcomes has not been borne out by time, clinical experience, or research. So the West spent 100 years pouring huge amounts of time into psychotherapy, and at the end of it abandoned it because it didn't actually make people better. So in the old days with psychoanalysis, you know, people were doing an hour times a week for years on end. And then they tried to make short, you know, brief psychoanalysis that would be 2 hours a week for 2 years or 3 years. And there were all different kinds of models of psychotherapy. You know, the heyday of the psychotherapy was really by the 50s, 60s, 70s, you know, where people would be going to their therapist 2 hours a week, and it would be an ongoing thing. And that all came to an end because it didn't make people happy. It didn't solve mental health problems. It cost a lot of money. And only people who had cash can afford to pay for it. So then you run into kind of problems of ethics and public health when you're trying to deliver mental health to the entire population. For people who can't pay for this, what are you going to do? What's social justice? And then people also started getting into the empirical business of studying, well, what is happening in psychotherapy and what is changing and what leads to change and is it improving people? And so a lot of research has been done, and there's very little evidence that long-term ongoing psychotherapy accomplishes anything. Now, that may not, there, just like everything in life, there are cases, there are individuals who describe individual benefit. But when you look at it at a population level and a research perspective, that's not been shown through research. And that is why mental health care has shifted towards short-term, targeted, structured interventions that in which improvement and outcome can be measured. And most of those interventions really are some version of the Buddha's clinical methods. So it's CBT, DBT, acceptance commitment therapy, you know, and when you drill down into what's going on in those, it's clinical Buddhism, basically. You're talking about mindfulness, correcting cognitive distortions, developing emotional balance, analyzing negative behaviors, and so on. And you go right in. If you go into the details of that, it's the eightfold path. And the inventors, like of say DBT, Marsha Linehan's open about it. She got it from Zen. I mean, she just lifted it 100% from Zen. Adapted a few terms from cognitive behavior therapy. And if you look in cognitive behavior therapy, there's not one thing in cognitive behavior therapy that is not there in the Eightfold Path. So just a sort of an update on psychotherapy in the West, that you know, it has moved into this short-term focused mind-body cognitive behavioral Buddhist approach to things that is very practical, tangible, measurable. And it's used for all kinds of things. So we can use it for hallucinations. You can use cognitive behavior therapy to decrease hallucinations in schizophrenia. You can use it for pain. You can use it for sleep. You can use it for depression. You use a longer version for affect dysregulation, impulsivity. You use it for substance abuse. And then you adapt it to different settings and so on. You get a feel for the different kinds of clinical problems. But, you know, as I like to say, at the end of the day, it's all just boiled down Buddhism. And the old fashioned, you go to a therapist once a week to kind of talk about your childhood, that's a thing of the past.
it's
But what is
amazing.
drawback? You tell me the drawback of CBT. Of what will be the drawback of that model?
Oh, there are plenty of drawbacks, but I'm just talking about the notion that long-term depth psychotherapy is going to make people better. That is simply not true. That has never been shown. And the West spent 100 years on this and abandoned it. The West is no longer doing it because it didn't work.
It's more like self-healing model, so to say. You have to be a participant in healing yourself. You have to activate certain, frames of consciousness or within yourself, knowing how, and heal yourself. I was interested in your consciousness-based psychology because it brings a bigger, larger framework, Sri Aurobindo's framework, which we are not even yet aware of. To really activate those levels, you have to really be a yogi in a way. And then to be able to tap into psychotherapy and to help people. I saw how Soumitra is doing in his clinic. It was amazing. I must, as a witness from outside, describe, when he sits with these people coming to him, you would not even see some kind of interaction. He is silent. He is deeply listening, looking as if within, and then something happens, and ding, and it is there. And I've seen this few times, and I was surprised to see the effectiveness and how precise the solution or the decision is made, and so on. And it is in the midst of people waiting there and here and everything, and it is happening. So you could feel it, even because being open to this kind of influence, you could feel that influence. It's quite interesting just to observe from outside. So this development, we have to become yogis to be therapists.
Exactly. It requires a lot of self-development.
Mm-hmm. There are more questions here. Would you like to why has canon and conspiracy theories and anti-vax found fertile ground in yoga communities? That's a provocative question from Julian.
It found fertile ground in every community. So.
All right.
Julian, who has asked this question, actually is in a better state to answer it. He would be able to answer it more.
Yes, Julian, would you like to answer?
Yeah.
Shall we?
Oh. Well, I would just link that to maybe something that wasn't asked but's important, and it implied in my comment that the yoga community is really not that different from other communities. It is in some ways, in the inner way, but actually, if you look at our community, there's no suggestion that anyone is living longer or that having less health problems or different health problems. I don't know that there's ever been a good epidemiological survey of the Sri Aurobindo community to see how we rank on health metrics compared to everyone else. But anecdotally, which can be flawed, we see about the same things everywhere, the same human problems, the same health problems, the same mental health problems, the same range of outcomes. You can see certainly an effect of the mother and Sri Aurobindo and intervening and often preventing the worst possible outcome. I mean, I've seen that where you can see, wow, this could have been much worse, but they saved someone. But still the problems are there, the problems of mental health, the physical health, they save the life and then they put you back to work working on the problem. And so that's just something to consider, and also that yoga, Sri Aurobindo's model, it's not a clinical method. It hasn't engendered some particular treatment model for some particular treatment condition. It's a self-growth, a growth in consciousness, a movement towards the future, a sort of a broad, all-encompassing thing. And so I guess maybe that's my answer to the vaccination thing, is that it's we're connected to the global movement. We absorb all the problems of the globe. We work them out in ourselves and in our community, and this is a global problem, and we're continuing to do collective yoga.
Yeah, there are some questions. Thank you. Do you have a book about the dream that Dr. Soumitra Basu was mentioning? Would you like to answer this? Shubindu has a lot of written in.
Our book will have a chapter on this. Our
Yeah.
book on consciousness-based psychology will have a chapter on this.
Shubindu writes quite a bit in the letters on yoga. You can find on the dreams, on the symbols, and different situations. It's quite amazing to read those insights.
I would just say also on the book here, there's a question if people can pre-order your book.
I don't know. We're still in the editing phase. We have to get it to the publisher, and maybe we'll be finding out in a few months what the print schedule is and what some of those. We'll let people know. We can ask the publisher how that all works.
So somebody asked how to differentiate between dream and intuition, but there are intuitive dreams. You have to develop yourself to understand that there are dreams which are intuitive. You see, the most famous, even in the practical world, it's not that even that yogis will have it. The Kekule dreamt of the snake eating its tail, and immediately he made the structure of benzene. That hexagonal structure of benzene was made after Kekule dreamt of little snakes eating their own tails. So we can have intuitive dreams.
There are more kind of psychological questions. How to free a person from schizophrenic voices?
Schizophrenic voices means what? Schizophrenia is a very big term.
Yeah.
And these voices, actually, people, we misinterpret, we use the term schizophrenia, then it becomes very problematic, because then you are classifying it into one level. Voices come from very different sources. There can be voices that come from your own depths. There can be voices that come from occult sources from outside. There can be different voices from different planes of consciousness. And then there are mystics who hear voices through intuition. They have intuitive voices that come, like the voice that came, messages and mantras that come to the seers, or what came to Moses, or what came to Prophet Muhammad. How do you differentiate what is a schizophrenic hallucination and what is a mystic experience? There is a very complicated question. So you have to see it in the context of the person who is having that type of voices and analyze it accordingly. Like a common answer, a general answer, it is very difficult to give a general answer, because we are using the words. When we use the word schizophrenia, then we narrow our scope. Actually, you just talk about voices, forget the word schizophrenia, and then we see that from where the source, where is the source, or what is the level of the consciousness of the person who is hearing the voices. Otherwise, this is the reason why many mystics can be labeled as schizophrenics. Or there is also a thin line between mysticism and psychosis. Sometimes there is a very thin line. So it's a very delicate subject. You have to see. Of course, if it is a very what you call a classical schizophrenic patient who is really suffering from psychosis, then you need to have medicines. Otherwise you will not be able to control. But not all voices are that you can control by medicines. There are other ways to deal with it, but all depends upon that individual. Somebody has asked that.
Also cognitive behavior therapy is now being used to boost medications, and learning cognitive behavioral techniques for distracting, minimizing voices, recontextualizing voices, analyzing voices. They do all sorts of techniques to try to, and the research shows that can be beneficial.
Of course, if it is blank schizophrenia, and there can be a command hallucination, then go and commit suicide or go and kill a person, then you have to be very cautious. You have to take different steps. So all depends upon the individual cases. Somebody has asked that we can use consciousness-based counseling in children less than 10 years, where we feel that they don't need medicine, but some spiritual help, and their parents are too immature to accept and work on this. Of course, we can use it in children, but doesn't mean that we have to be very strict that medicines are not needed. In some extreme cases, you have to you have to give a little bit of mild medicines, but that doesn't mean that you have to give what you call strong psychiatric doses. Sometimes I use flower remedies for children with fears, phobias, anxieties, and dreams. I use a lot of flower remedies. We use. Remember, Michael, that child that we saw, you and me saw the
Yeah.
movie when you had come in Calcutta, who was who had a lot of libido and his eyes
Yeah.
were different, and that we gave him flower remedies, and he has now grown up to be a young man, very smart, very successful in his life. And
Nice.
that time we had analyzed that he had brought it from some past life,
Mm.
because there was no explanation. We
Mm.
had taken a full history, and there was no explanation of any influence that could increase his libidinal outlook of the world at such a small age.
Mm.
And his eyes were such, and that we had, Michael and me, had observed for a long time. And I had just given flower remedies for that.
Mm.
So of course, medicines doesn't mean that we are giving drugs. We can use
Right.
also.
There are more questions here. You can pick up if you see what is what
Yeah,
you would
they're
you.
not showing up here. The last one was
Yeah,
about schizophrenia.
Michael, somebody, Dr. Sudhin Bisas has asked you, yeah, specifically has asked you, does Feng Shui article bring positive vibes? As I see an article behind you at the door. There is an article behind you at the door. Something, a Feng Shui is there. Something is hanging there behind your door.
Oh yeah, yeah. Those are chimes. Those are
Uh-huh.
chimes. Those wind chimes. We use them in our to signal the end of a meditation. But yes,
Yes.
they definitely bring positive energy. Absolutely.
Uh-huh.
Anything
And
beautiful
then,
brings positive energy.
and somebody has talked about our integral health system when they held, yes, that integral health system is something that you have to work on yourself. The system is not yet ready, but things will change. Things are definitely going to change in the future. You see that a lot of people are more interested in ecology. That is a
Yeah.
step forward towards integral health, that focus on ecology. Mothers, even in India, they don't want their children to have too much antibiotics. That is
Yeah.
also, the mothers also don't want. So everywhere, subtle way, you see that subtle way changes are happening. In surgery, we have, wherever it is possible, we have switched to minimum surgery. No? We have
Yeah.
gross surgery has been replaced by minimal surgery. So that is also an indication, no, that you are moving towards more subtle rhythms. So all
That's
these
true.
things are happening. It will take time.
Yeah. No, that's definitely true.
There is one question interesting here, the last one. Over the years, have you developed concrete exercises you give to your patients to develop their capacities for concentration and bringing peace, as
Yes,
the
yes.
terms are used?
We have developed those exercises, and our book has got a number of such exercises. When it comes out, then you will see that it has a number of such experiential sessions. We have given number of experiential sessions, and which are pertaining to personal growth. We have given.
Mm.
Great. If you have to conclude, to close up this question and answer session, it would be wonderful just to conclude the whole kind of futuristic development of this consciousness-based psychology in the future, or some conclusive remarks. Please do. That would be lovely to close our session.
Mm.
I would say just two lines, and from there Michael can take, because this is what Michael was elaborating very nicely. That with mindfulness, meditation, and the Buddhist influence coming and changing our ways of things, we have moved a step forward.
Yeah.
Now there is another step which is there beyond, where we bring the Shakti, the
Right.
Chit Shakti aspect, or the consciousness force aspect, which Sri Aurobindo says. Sri Aurobindo was so fond that even the Sachidananda, he modified Sachidananda to be Sat Chit Shakti Ananda. So that Shakti aspect, which has been missing in the Western world, has come to a certain point and has accepted that Buddhist philosophy. It has accepted the Buddhist what you call principles. It is very good. It is one
Yeah.
stepping stone. But the next stage, when we will be witnessing, when we can acknowledge the Shakti that is operating, which opens again a wide field. For
Yeah.
example, I was talking about when Of course, Michael was talking in some context about how the CBT has this cognitive behavioral therapy has developed. But even beyond the cognitive behavior therapy, there is something more, because the cognition is controlling the behavior. But beyond the cognition and the behavior, there is another fourth dimensional principle which is there acting. So which you can go there, that you can be more direct, and then you can go upwards and you can invoke the Shakti. Then you see that what dynamism it can bring it into our psychological practice. Together with it, of course, with the Shakti, it comes how you deal with occult factors. Because even in the Life Divine, Sri Aurobindo has said towards the end that when all things have been controlled, all factors have been accounted for, there is one factor that still remains, which can upset everything, and that's the occult factor. So that is also something without which psychology is incomplete. So I think Michael will finish.
Yeah, that's a beautiful, important reminder. And so, yes, that's the take-home point. And connecting to this thing about what's happened in the West, the acceptance of these Buddhist clinical methods of mindfulness, meditation, balanced living, it's quite notable that in the West, people are doing this, but without the philosophy of trying to transcend the cycle of birth and death. Nobody's talking about trying to, transcend, not be reborn. Focus of how they're using these techniques is to try to change the outer being, and they're starting to connect with inner being, and they're opening to Shakti. So it's a transformational approach. And so this is where Sri Aurobindo and the Mother, really become necessary, because they explain that whole thing, the Shakti and the transformation of consciousness. And what do you do if the goal is not nirvana? Say the goal is transformation, then what do you do? So like that, they need Sri Aurobindo and the Mother. It's inevitable. It's coming. It's coming. It's not that far off. I'm really stunned in the last 20 years. 20 years ago, it took me 44 revisions of my article on Sri Aurobindo to get it by the editor of the Harvard Review of Psychiatry. We fought for 2 years, and he finally said, "I'm going to publish it because I'm tired. I agree with you that I have no further logical objection to this, but I disagree with you. I just don't want to publish it. And next time, please pick another topic." So he went ahead and published it because he couldn't think of any reason not to. 20 years later, Boston is Buddhist. I mean, every clinic, every hospital, groups, coaches, individuals, mindfulness. Now in the VA, when I go on a morning meeting in primary care, they always have someone start with a meditation, and this person starts talking about chakras and the earth and going down, and maybe you feel a goddess in yourself. And I mean, it's unbelievable. This is, it's not 20 years ago. So it's all over the place. And so then it's just a matter of time. People are opening, they're having experiences, and their own experiences are going to lead them inevitably to Mother and Sri Aurobindo, because no one else has the answers.
Thank you. Thank you very much for this beautiful exposition today in this session. And we hope to connect with you again in the future.
Good. Will do.
Namaste.
Namaste.
Thank you. Thank you very much.
Thank you.